Understanding Special Education Guidance During the COVID-19 Pandemic. Special Education Team, Division of Learning Support, May 2020. The purpose of this presentation is to help develop a greater understanding, particularly for families, of guidance issued to date in response to challenges facing school communities as a result of the COVID-19 pandemic. During a time when many aspects of our daily lives have changed, it is important to note the many areas that remain constant. For example, the Department of Public Instruction is open and is continuing major functions. We continue to support districts, families, and students with disabilities during this time. One change affecting the public is that we are not currently receiving in-person visitors at our locations, but DPI staff are working remotely and happy to respond to questions by phone or email. As always, better outcomes are achieved when there is active collaboration between parents and schools. We urge school districts and parents to work together on behalf of students with disabilities to meet the requirements of IDEA. There have been many examples of innovation, individualization, advocacy for resources, and flexibility in modes of delivery to meet students' needs as families and educators tackle the challenges before them. During this public health emergency, we encourage districts and families to prioritize the health and safety of students and school personnel. Currently, districts are varied with respect to distance learning, and while face-to-face services are not possible, the department encourages using all available resources to create a meaningful distance learning experience for all students. Additionally, flexibility is needed during this time to address staff and family illness, limited access to resources, inability to complete evaluations or IEP meetings safely and effectively within timelines, and in some cases, a parent's desire to postpone these steps. Much of the guidance discussed in this presentation focuses on these flexibilities. The purpose of this presentation is to provide a better understanding of the guidance produced in connection with the COVID-19 pandemic and the resulting circumstances. Therefore, we would like to begin by highlighting the guidance that is most relevant to this presentation and share where the guidance is available. First, DPI maintains a centralized webpage of information for schools and families related to COVID-19. The special education team also maintains a webpage specific to COVID-19, which is the second link on this slide. Finally, much of the discussion in today's presentation will relate to the DPI Special Education Team's question and answer document titled Extended School Closure Due to COVID-19, Special Education Question and Answer Document. Similarly, the U.S. Department of Education maintains a centralized web page with information related to COVID-19, which is the first link on this slide. While the U.S. Department of Education does not currently maintain a web page with information specific to COVID-19 as it relates to special education, much of the information specific to special education is available through the IDEA News and Media Updates webpage, which is the second link on this slide. It is important to note that guidance updates occur frequently due to the rapidly changing circumstances, and information in this presentation is specific to the guidance available from DPI and the U.S. Department of Education at the time of this presentation. Specifically, the guidance topics we will review in this presentation cover IEP timelines, meetings, revisions, and procedures, missed services and alternate educational opportunities, evaluations, graduation, and family engagement. The department understands that during the public health emergency, it may be difficult for school districts to comply with IDEA timelines. Districts must adhere to timelines to the greatest extent possible. The department reminds schools and families that it is acceptable to hold IEP team meetings remotely, either by telephone or virtually using video conferencing software. When IEP teams cannot meet in person, districts must take steps to ensure families have the opportunity to meaningfully participate in the meetings using alternative means. However, some parents may be unable to participate or uncomfortable participating by phone or by video conference. Anytime a parent makes clear their desire to participate in the meeting, but prefers to wait until the meeting can occur in person, the school district should wait and hold the meeting in person after the public health emergency. In some circumstances, a parent may want the IEP team to meet without them. In this case, districts should document the parents' wishes on the participation section of the cover page of the IEP and proceed with the meeting. When it is not possible to comply with the timelines, it is important to communicate the reasons for the delay. Families and school staff should be sure to document conversations and decisions about delaying meetings and then agree on a plan for moving forward once the public health emergency is over. Delayed meetings should occur as soon as possible at that time. Even though schools are closed, parents can still request IEP team meetings, and district staff still need to respond to all parental requests for IEP team meetings. Districts are encouraged to grant all reasonable requests for IEP team meetings. If the district denies the request, it is important to provide the parent a response in writing. All required IEP team members should participate in the meeting unless appropriately excused. Parents should let districts know about any barriers to participating remotely. For example, if a parent is concerned about internet connection, the district may be able to help by providing a wireless hotspot or by conducting the meeting by telephone. Another example of a barrier would be a parent with many children at home who is unable to find a quiet space to participate in the meeting. With parental agreement, necessary changes to IEPs may be made without an IEP team meeting using the Notice of Changes to IEP without an IEP meeting form, or its equivalent. Typically, districts seek parental agreement verbally or by email and are not required to obtain a signature. This may be appropriate when a student requires services that are additional or different due to switching to distance learning. For example, if a student requires an assistive technology device at home in order to benefit from specially designed instruction delivered virtually, the IEP can be adjusted without an IEP meeting if the parent agrees. Some districts are able to continue using standard mail, while others may not be able to do so as a result of the public health emergency. Therefore, families can expect that more information will be communicated electronically, including IEP documents. Additionally, the IDEA contains some specific provisions requiring districts to obtain agreement or consent from parents in writing, such as obtaining consent for an evaluation or documenting whether parents agree with the conclusions regarding whether a child is a child with a specific learning disability. Parents may be asked to send an email providing consent or indicating agreement. Alternatively, some districts may request electronic signatures. Families should communicate any challenges they may face using these electronic formats to the district. During this public health emergency, it simply may not be possible for a district to provide all the services that are outlined in a student's IEP. If a district can continue providing learning opportunities and special education services during this time, they should try to do so to the greatest extent possible. Special education law allows for flexibility in determining how to meet the individualized needs of students with disabilities, and specially designed instruction and related services may be provided remotely when appropriate. Districts must communicate to parents how services will be provided during this time and document both the decision and the communication. Given that some services outlined in a student's IEP cannot be provided during the public health emergency, both districts and families should keep track of the services that students do not receive. After the public health emergency has ended, districts will have to consider whether and to what extent compensatory services may be required. The U.S. Department of Education has yet to provide specific guidance on how districts should address these missed services. We will provide any new information and update our guidance when it becomes available. School districts are encouraged to provide all students with learning opportunities so they can continue to make progress in the general education curriculum. Districts should make sure that these opportunities are available to students with IEPs and should consider what supports might be needed so that these opportunities are accessible. School districts are also encouraged to implement IEPs to the greatest extent possible. This may require using different instructional methodologies or different formats. Since it may not be possible to conduct assessments during the public health emergency without the student being physically present, districts may extend the evaluation timeline in order to complete the assessments as soon as possible once the student is available. This is similar to situations where, for example, a student is hospitalized and therefore becomes unavailable during an evaluation. The district should communicate and document the reasons for the extension to the parent. One disability category specific learning disability, has unique procedures for extending the timeline with parental agreement. If possible, IEP teams should use these procedures when applying specific learning disability criteria during an evaluation. In some cases, the IEP team may determine that no additional data are needed to complete the evaluation, or that it may be possible to conduct additional assessments virtually. In these cases, the IEP team should continue with the evaluation to the extent possible in order to comply with the 60-day timeline. Graduating with a regular high school diploma or reaching the maximum age of eligibility both result in the ending of a student's eligibility for special education services under IDEA. School closures due to the public health emergency may have caused disruption to the progress students were making toward graduation at the end of the 2019-2020 school year. Each district must determine how to address this disruption for graduating students. Under typical circumstances, each student's IEP team must meet to review the student's status and issue the appropriate notice of graduation or notice of ending services due to age a reasonable time before the student's eligibility is terminated. The district must also provide the student a summary of performance prior to graduation or ending services due to age. As this is an issue of IDEA eligibility, the department recommends districts make extra efforts to complete these steps in a timely manner. Some IEP teams may have already provided a notice of graduation or notice of ending services due to age to certain students. In these instances, IEP teams should consider meeting again to review the student's status in light of the extended school closure. Parents with questions about their child's continued IDEA eligibility related to school closures should request an IEP team meeting to discuss their individual circumstances. Districts may, but are not required to, delay awarding a regular high school diploma to a student who has met all graduation requirements but has not obtained all of their IEP goals. School districts should consider this option if the extended school closure has significantly interfered with the student's special education and related services, particularly transition services, and the IEP team determines additional services are appropriate. Remember, as members of the IEP team, parents have always been very valuable because of their close and long-lasting relationships with the student, and because of their firsthand observations of their children in a variety of contexts. This role is more important now than ever, since families are able to observe a child's progress in person during remote instruction. Families should share their observations with teachers and the IEP team. The department has been collecting and receiving information from families during this time, and understands that families are in different places, have different needs, and have differing access to and familiarity with technology. Some families are feeling that too much is being asked of their students at this time, and others feel that not enough is being offered. While the purpose of this presentation has been limited to the guidance documents set forth at the outset, the department recommends further exploration of resources that families may find useful. The department has developed infographics to support families titled Learning During COVID-19 and Learning Every Day, Everywhere. Additionally, the department is continuing to produce new guidance for families, much of which will be posted on the Resources for Families in Schools section of the COVID-19 webpage, where there is already a lot of good information for families on technology assistance and helping children cope. During this public health emergency, partnership is more important than ever. The department is happy to assist educators and families as they work together during these challenging times. If you have any questions, please contact the special education team at 608-266-1781 or by using the online contact form available through the link on this slide.